This is Dr. Dan Beilin. I'm a licensed acupuncturist, doctor of Oriental medicine, and physiologist, neurophysiologist, past in UC Davis, UCLA, gastroenterology, neurosurgical research, and entrepreneur and inventor of regulation thermography device that can non-invasively indirectly assess organ function. And so we have our call-in guest tonight, and we're going to dial her up right now. Hello, Casey, are you there?
I sure am.
And Casey, just tell us a little bit about your history of bowel disease and what you went through, and what you went through, especially with the medical system as it is today, and how horrible this was to go through, and how you managed to get it under control. At least you're about 80% under control. Maybe I have some ideas about what you could do to finish up that job, but give us a history of what you went through.
Sure. Well, I had a lot of chronic childhood illnesses, many that were mysterious, and I was in and out of physicians' offices, seeing specialists, and going home much of the time with antibiotics. I had taken hundreds of antibiotics.
Hundreds?
By the time, hundreds. By the time
I was... What did they
say
you had? What was your diagnosis?
It was during the 80s, and at that time it was very useful that they prescribed antibiotics not only to diagnose, but to guess what was going on. So every time you had a symptom, they would try an antibiotic to see...
Now, what were your symptoms, and what did they call what you had?
So as a child, I had a lot of respiratory infections, lots of tonsillitis, lots of ear infections, sinus infections, urinary tract infections. It was basically my whole body would have really intense infections. I'd have high fevers.
And how old were you when you had all those tonsillitises?
I didn't have any illness until I was 1 year of age. And my mom is pretty brilliant. She kept a date book of my history, which actually was quite helpful when I started putting together my chronology. But from 1 year on, the cycle of infections started, and they just increasingly got worse as I approached, my teenage years.
Now, did you have ear infections as well?
Many ear infections.
And so what were you eating at the time? Were you drinking milk, and what were you eating?
We had just sort of a standard household diet. My mom was very focused on balance. So, yeah, I did eat dairy, but we had fruits and vegetables, ate meat, didn't drink soft drinks, had a clean diet in terms of, not eating a lot of artificial products and whatnot, but definitely... dairy and meat and fruits and vegetables and carbohydrates, pastas and rices and lots of casseroles.
So even at 1 year old, what do you think provoked it? Did you have anything that you're exposed or obvious that came around that wasn't originally with you, that infected you?
Well, I've spent my entire life looking back on it, trying to figure out what caused it. And I can't pinpoint anything in particular. I wasn't exposed to just one thing. We lived in a small rural community. There wasn't, radiation and, a lot of toxins.
No, you say in a rural community there's not radiation.
Well, this was back in the 80s, so we didn't have cell phone towers and things like that. Is what I'm talking about.
Well, there was nuclear testing, but then not around. Where did you grow up?
It was up in the Sierra Nevadas.
Oh, I see. So at an elevation.
Mm-hmm.
What about pesticides?
We weren't around a lot of farming. It was not a lot of agriculture. It's primarily based on the timber industry, so lots of logging at the time.
I see. And did you ever notice you were bitten by any kind of insect?
No, definitely not.
Okay. So what do you think, looking back, was the cause? Do you think it was a dietary? Do you think it was vaccinations? Or what do you think stimulated that?
Well, I don't believe that there's one particular cause. When I look at my history, I would say it was a culmination of many things. There was, likely maybe some genetic predisposition predisposition. There was also a lot of stress and trauma in my household. I had taken a lot of antibiotics, so who knows, had I had just taken a few antibiotics at the onset of some infection, my system might have been, a little more fragile than most. But I did have a lot of different variables that, I believe it was a combination of all of them that put my immune system over the edge, and potentially food allergies and,
now, did you
environmental.
Did you go through allergy testing like I did with the scratch testing?
By the time I was in high school, I'd been on allergy immunizations. So I actually did those for about 6 years, which at the time was a little longer than what was recommended initially. And I did go through the typical allergy skin testing and the shots, 3 or so per week.
Did those help you in the first couple of years? Were they helpful?
I don't think that they were. I can't say that doing that made any difference in my health.
Yeah, I had those for 5 years, and in the end of the 5th year, all of a sudden I turned 13, and I had no allergies whatsoever overnight. Within 1 week, I was no longer allergic to cats, no longer allergic to milk, no longer allergic to dust. In 1 week. Up until then, I was getting shots and still reacting to all those things. So I told my mother, and she said, well, I guess the shots worked, which I thought was incredible because, with the changes that happen when you're a 13-year-old boy and the chemical changes, hormonal changes, it was more that I just grew out of them. So,
yeah.
And then I started having nightmares when I was first starting and all during the time I was receiving those shots. And they were severe nightmares, much worse than most anyone in my class or with my friends. And it was, looking back on it, I wonder if there was adjuvants or other things in the vaccines that could have had an effect on my nervous system.
Sure. Yeah, I really didn't notice a change in my allergies, food allergies, environmental allergies, until I started doing a technique called Namboodiripad allergy elimination technique.
Yeah. I've taken her course.
Yeah, me too. And that wasn't until I was in my mid-20s that I discovered that. So, and that started to change things. Absolutely. I cannot say anything but great things about it.
Yeah, so tell us a little bit about that, because it's very effective with a lot of people. And it's a way of kind of desensitizing people to specific things that test out. But it's using muscle testing, right?
Yeah, it uses muscle testing, applied kinesiology. But it's also, the doctor who created it is brilliant. She's PhD acupuncture, chiropractic. Her credentials are amazing. And essentially, I like to call it a reset of the immune system. And it just poses that, we have these things that we come in contact with in our environment, the food that we eat, chemicals, and these sorts of things. And it's not in the traditional sense that you always get a runny nose. These things that are irritants to the system can cause the immune system to get imbalanced and start going awry. And NAT helps reset the immune system. So through a series of treatments, your body no longer recognizes what you're being treated for as an offender. It creates a balance with it, so you no longer have to react to it.
How do you think that works? Because say you find in the ampules that they test and they used for muscle testing, say you had a real big reaction to mustard. And so how does that work? How do they desensitize you?
Well, there's a lot of it that's based on nutrition and on acupuncture, and I probably wouldn't be the one to to describe what really is going on behind the scenes. But what I do understand is in the vials, each thing that we come into contact with has a frequency, and our body is very smart. And through the stimulation of these acupressure points on the body, you are able to essentially reprogram your nervous system and your organs to not respond. And it's based on a number of principles that are sort of a culmination of Dr. Devi Namboodirpad's years of studying. And so it has been studied. There is some evidence-based research out there about it. So anybody that's interested can certainly go to NAAT.com and see the studies. I've got some studies on my website, and it's just an amazing technique that I have had great results from.
So anyone that wants to talk to Casey and ask her about her journey, we're going to continue with her, how this all turned into Crohn's disease in a minute. But the call-in number is 831-479-1080. That's 479-1080. This is Dr. Dan Beilin talking to Casey. What's your last name?
Hirsch.
And so what's your website, by the way?
So it's www.lightyoursparkle.life.
And sparkle is like your vitality. It's kind of like light your vitality. Well, tell us how this changed, or all these recurrent infections got into the bowel. How did they do that?
Well, I always had a lot of gastrointestinal problems. So while I was dealing with a lot of infections, I was having a lot of GI issues. I don't really remember having, the normal childhood experience, whatever that is, where you go to the friend's house and you spend the night without having many trips to the bathroom. I had lots of vomiting. So there was always a GI component. It just that my physicians at the time thought I was just getting the stomach flu over and over again.
But didn't you have blood in the stool?
I didn't have blood in the stool until I was in my college years, and I started going through a lot more diagnostics at the time because it was difficult for the specialists to understand whether it was gastrointestinal, whether it was coming from the urology system, or whether it was coming from the female organs. And so I had years of
Why
back
would they
and
be
forth.
confused about those very different systems? Why would they be confused about that?
Well, my personal opinion is that, traditional medicine looks at the body as fractured, fragmented parts. It doesn't look at it as a holistic.
It's anything but traditional, because traditional
Sure, conventional medicine, absolutely.
Yeah, they don't think systemically into multiple system integration. They go into specialization, and then it's really funny how the gastroenterologists pretend they don't know anything about the urologists.
Right.
They don't know anything about the pulmonologists or the, and it's really funny because they've all studied all of each other's fields and done grand rounds over the years of medical school. And they're very careful about not stepping on other people's feet when the real reason for them to go into medicine is to help people.
Yes, and it would have been most helpful had they spoken to each other, because I was bounced back and forth between these different specialties, and there was an overlap between all of them because I had inflammation, I had common symptoms of pain and gastrointestinal upset and infection, but I had really decades of going through this process of frustration, and then eventually I was given a diagnosis of many different things. So I had lots of labels, and it was truthfully my passion.
What were
go ahead.
Those labels?
So I was diagnosed, of course, I had migraines, and then I had chronic fatigue syndrome, and then I had interstitial cystitis, and then I had endometriosis, and it just goes on and on and on. And eventually we sort of landed on the diagnosis of Crohn's disease. And I'm not a big fan of the labels in terms of just, I have imbalances in my gut. It concentrates the most in my gut, which is where my symptoms are. And that's my focus, how to heal the gut. But it was eventually determined that Crohn's disease seemed the most rational based on my constellation of symptoms and my testing.
Well, you had colonoscopies that would have shown the Crohn's, at least in the end of the small intestine.
And I had lots of medical mishaps and some trauma. I had a laparoscopy where they thought that I had endometriosis, and that was the focus was to go in and diagnose it, and in the process my iliac vein was nicked in 3 places, and I had major surgery, lost feeling in my left leg for quite some time, and almost didn't survive what was a simple procedure. So I had some traumatic experiences, with the medical system too, and not so much anymore, because I have found my way to create a health program and an integrative team that supports me in a way that, values what I know about my body.
Yeah, I mean, any doctor that doesn't respect your own experience of your symptoms as being a reality, you should go to a different doctor.
Absolutely. That's just all about empowerment. I mean, I live with my body every single day. I spend the most time with me, and naturally, I'm the best expert on my body, and it's really up to me to sort through information and ultimately make an educated decision that's best for me, and that's also influenced by culture, beliefs, emotions. These are all things that feed into how one responds to treatment and the selections that we make. And those are really important when, meeting with a healer or a physician.
So, in other words, what percent out of the woods are you free of symptoms and healed?
No, I don't like to say that being healed is a goal. I mean, this is sort of, what is being healed? Like every single day we're exposed to new things. Our body's aging. Symptoms, emotionally and physically, are a part of being human. What I will say is that every day of my life, because of the interventions that I do and the care that I have for myself, my quality of life has continued to get better and better, and I'm able to live the life that I want because of the protocols that I have and the team that I have. That being said, I still have relapses and remissions, but I'm still having less of them, and the quality of my life is dramatically improved and will only get better with what I know today.
What are the most important factors that you've learned that you can, communicate to the audience about how you approached these things successfully? What were the most successful tools that you learned?
Yeah, I feel like it goes back to empowerment. You have to know yourself and know what works for you and know what you're comfortable doing. Instead of taking information from the people that you're getting, information from and assuming that that's the answer, you have to sift that through who you are, how your body responds, and then make a decision based on what you've observed about yourself. And so I just can't say it enough that I've been suggested through the years hundreds and hundreds of different diets, hundreds of different interventions, and what might work for someone else isn't what works for me. And so I know that there's not a one-size-fits-all, that I have to craft what works for me, knowing what I know about myself.
But you must have, say, 3 or 4 things that were most important, like diet, like anti-inflammatory supplements, like meditation. You must have 3 or 4 things.
Well, for me, the 3 or 4 would be absolutely diet's been huge, and taking nutritional supplements. I like to look at a healing wheel concept, which is physical and emotional and passion. My healing wheel would include having, good nutrition, taking dietary supplements. Emotionally would include, making sure that I'm addressing the impact of past trauma on my body through psychotherapy and doing good emotional work. And then passion is really important to me. I participate in ballroom dancing. It is, my soul. It just makes me feel alive. And, I have a quality relationship with my husband. I love my pet companion, my 20-year-old cat. So these are things for me that if I had to look at, what has been most important, it has a little bit to do with physical, emotional, and passion. Then I speckle in some NAET. I'm really into another technique called biomagnetism, and I really build my world around an educated, integrative team of healers who all respect me for who I am and work together, and that's huge for me.
Yeah, that's recently I've been at UC San Francisco and UC San Diego, and they're catching on. Like, some of these centers have realized that the patients are, they're real and they know something now, and they're all on the internet, and they ask much more intelligent questions than they did 10 years ago. And they're catching on. You can still find, 50% of all doctors that haven't caught on, and they're at, various either clinics or medical centers, and you just have to use the ones to your advantage that are awake.
Yeah, it's part of being informed. And, you know, I'm a licensed clinical social worker, so my world lives and breathes relationships. And it's important to have a quality relationship that you can count on and with someone that you trust when you're looking at someone to be part of your integrative health team. And that looks very different for each person, but the quality of the relationship is important, and feeling like you're heard and like what you have to contribute matters, and that you're part of the decision-making team and not just told, here's what you should do, go do it, especially if that's not something that feels right to you.
Well, one of the most important things I think as a practitioner is that you always have to switch paradigms, and that means that you have to look at things through different filters. You have to look at the patient through several filters if you want to know truth, because truth will be the same in every filter. So that if you look conventionally and look at their blood tests, and then you look in terms of, say, Chinese medicine or Ayurvedic medicine, and then you look at in terms of their traumas, and then you find a consistent line through all of those that would influence the patient to come out with that particular pattern, because any pattern of disease is not really the person. Their vital force is the person, is the being in front of you. And so I learned the most myself through homeopathic medicine, because the philosophy section of homeopathy by Hahnemann and Kent were the most powerful background understandings of the laws of healing. And they have some very powerful true laws that are true in conventional medicine as well as alternative medicine. And those have been most helpful to understand what it means when a person is getting better, so you can recognize those things. But a lot of doctors can be very respectful of you and want to be on your team, but they don't think outside the box or change their paradigms. They always look through their own filters still, and that way that makes them blind. And we need practitioners that have been awakened, because and I mean spiritually, very, very as a very important aspect to how our practitioners or healers should be. And there are more and more MDs that are in university places that are awake. I just spent an hour with Dr. Navio in UC San Diego, MD, PhD, who is studying. He said something very interesting to us. He said that the laws that have been discovered in medicine and the laws of healing in medicine are rediscovering principles that have been known by traditional and shamanistic and ancient healing for thousands of years, and we're only rediscovering what they've already known. So he's actually, he's a professor of medicine. At the same time, he's spent some time in South America exploring some of these other systems. So, those are the healers. Those are the guys that have a lot of science, and then they said, okay, we're going to place that on the side, and then we're going to include these other paradigms, because for any system of medicine to last 5,000 years, like Ayurvedic medicine and Chinese medicine, there has to be truth in them. They can't just be thrown aside and say, well, those things are a waste of money, or those things are, it's ridiculous, because those things have worked for thousands of years. It must work.
Yeah. Well, and I think it's true. The systems are starting to maybe perhaps gradually change, but it's not just the medical system, it's the mental health system as well that's really important, because there needs to be a connection between what's happening when a client goes and sees a physician or a physical issue. There needs to be a connection with mental health and psychotherapists and clinical social workers about the emotional components, because both go together. And I'm still seeing that there's some fragmentation in terms of that. We often focus on one, either physical or we focus on emotional in all disciplines, and we don't often integrate the two together, which is in my hope that eventually, as all these other changes are happening and people are starting to progress, that starts to come along as well.
Yeah, again, our number is 831-479-1080. Please call in if you would like either one of us to help you with your particular self or friend or relative. Casey, tell us about what's available on your website, because you have this three-pronged healing dynamic that you help people with. Is that right?
Mm-hmm. Yeah, the website was designed to be educational. After many years of trying to figure out where to go for information and combing through the internet and reading, it's exhausting when you don't feel well, trying to make sense of information. So I wanted to have a site that was integrative and that people could go and access a lot of diverse resources, with the idea that the healing wheel is something that people can look at individually. They can look at how that applies to them, because obviously my healing wheel isn't going to work for everyone else. So this site was designed to be helpful, supportive, and integrative. And, of course, I'm available for, psychoeducation, doing, speaking engagements and things like that. But at this moment, the site was designed to just be available for people as a free resource to help them navigate some of these complexities that exist when you're dealing with chronic illness.
And what are those three prongs?
So the healing wheel is comprised of the physical, the emotional, and passion.
Why is passion separated from emotional?
Well, that's been a question that, has been posed to me before. And, it's just a personal preference of mine. I want it, emotional for me is more thoughts and beliefs and perceptions. Passion, I just wanted a category because it's so important that our joy it needs to stand as like an important piece on its own. We need to always say that's just as important as everything else. So passion is all the things that give you zest and give you joy.
But some people who are in depressions can't get to that place. What do you do?
Yeah, well, I think we all have strengths inside of us, even when we're in a funk or depression and we feel like we've lost hope and we have nowhere to go from there. Each of us still has a strength inside of us. And it's those strengths that give us a little glimmer, that help us find that sparkle inside of us. It exists in all of us, no matter how miserable life can get and how hard it can get. And I think it's just really important that people are able to remember those strengths, and those are the things that are the most fundamental to help pull you through that and give you that opportunity to, access these various dimensions of the healing wheel. And of course, we need help. We need support. Relationships are vital. That means, having a psychotherapist, having a good physician, having a friend, having a pet, having a family member. These are all parts that help us remember who we are when we forget and when we feel like the sparkle isn't there.
And what kind of psychotherapist? Because, I've been to many psychotherapists who sit and talk and really don't get deeper. And have been a waste of thousands of dollars. And I've been to others that do body-oriented therapies, like Reichian therapy, where it's night and day, or other forms of, say, holotropic breathing, whereby you're doing an energetic release, which is behind the emotion, that frees up a lot of that space and makes you into a bigger human being so that you're more able to cope with things. Why do you mention psychotherapy that is, you're really in a crapshoot with how good a therapist is, because there are a lot of bad ones out there?
Yeah, it's the same for psychotherapy, for mental health, whatever term you want to use to capture the idea of going and seeing someone who's trained to be able to help you process emotional issues and trauma. And just like finding a physician, and how difficult that is to find that person that's a fit for you, it's also challenging, as you say, to find the right fit for you in a therapist. But what I always like to say is that, that is something that the patient has to be proactive in terms of interviewing the psychotherapist, clinical social worker, counselor. You have to be proactive, and most therapists will allow you to have a session where you just ask them questions and you find out, does it feel right? Is this a fit for me? And going into that process, it's important to know and be clear, what kind of treatment are you looking for? Are you wanting to heal childhood wounds? Are you wanting to connect more to your body? And there are various specialties. And there's many resources that are available online, the APA, the NASW, that people can get as a start. Psychology Today has articles on how to find the right fit for you as a therapist.
Oh, boy. Well, that's outside my league because I'm an alternative doctor, and Psychology Today would not be my first reference point for finding a therapist. I would go more in line with getting recommendations from people who have been relieved from a lot of trauma, and some of the methods that are fashioned around trauma, like somatic experiencing, like rapid eye therapy, EMDR, and some of the somatic therapies, because a lot of things are buried underneath our consciousness that we can't talk about or we can't really express because they're bound so far into the body. You really need some subtle hint in a very constructive way. And you have to also, with people that are traumatized, you have to make sure that they don't stay in the trauma processing when they leave your office. And the problem with a lot of therapists is that they confront full force into a trauma, and then they have you like working inside the trauma and going through all the hell and reliving all the hell, and then they kind of don't really get to a point of resolution before you leave the office. And I've seen that quite often in methods that are what I have a lot of respect for is Peter Levine's work, who is a neurophysiologist and understood the physiological impact of the vagus nerve, and Porges's work on the vagus nerve and the different ways that our systems react inside of ourselves, having to do with the nervous system, and then ways to assist the reprogramming of our nervous systems to be able to have a resource energy within ourselves to be able to not have the trauma impact us as much. Of course, we're always going to remember the trauma, and we'll always feel the trauma, but the point is to feel it less and less and less. And I in this point, I can't even put down methods like Scientology because I know that Scientologists do a lot about trauma, and they go in, but they go in pieces, and they take it apart and in certain pieces in a constructive way. And I really haven't seen as big benefits that with talking therapy as I've seen with somatic work and some of the new stuff that's coming out having to do with somatic therapies. Have you tried those?
Yes, and I concur entirely that trauma, talk therapy is coming from the cognitive part of our brain, and trauma lives in the emotional part of our brain. And Bessel van der Kolk had come out with a book called The Body Keeps the Score. And I feel like, for folks who really want to understand what happens to our nervous system and our brain when we experience trauma, along with Peter Levine, those are great resources. And I am a believer 100% that you have to address the root cause of the emotional traumas in the body, and talking about it is not as useful as various somatic therapies. I also just want to caution people, though, there are many healers that are out there that are doing phenomenal work to help patients release trauma in their bodies. There's many different modalities, which I'm not going to get into those right now. Not all of these folks are licensed therapists. And so you have to just find the fit for you that helps you get to the root of what's going on. And in my case, I have done a lot of different somatic therapies, which have been very effective, but I've also done a lot of emotional healing when you talk in terms of what happens to the body when emotions get trapped. in our, in our tissues, because trauma gets very deep inside of us. And how do you release that? Well, there's ways to do that emotionally. There's ways to do that with energy medicine. And there's ways to do that with techniques such as NAET. There's an emotional component to that as well. So we're just barely scratching the surface. But my main point is that finding the right fit for a therapist is equally as important as finding the right fit for a physician, and that requires, talking to other people who have had results, talking to your, medical team if they've already have, patients who are struggling with similar situations, and doing your own research to find out who you think is going to be a fit. I have interviewed many therapists, physicians, and healers in my lifetime, and there's only a handful that actually turned out to be a fit for me. And sometimes you try it, it doesn't work, you move on. That's sort of a process of getting to know yourself and changing too.
And don't forget that the gut has a lot of impact on neurotransmitters. So your gains through therapeutic techniques can be enhanced if your gut is non-inflamed and has a good bacterial balance within it. So
yes.
I think it would be a really great thing if there was someone that specialized in gut-brain. That should be a specialty of medicine.
Mm-hmm.
And then so they would take amino acids and they would understand some of the genetic weaknesses so that we know what can be triggered. I mean, genetics don't cause much of anything. It's the trigger to the certain genes that enable messages to be conveyed to the organ systems. And of course, anytime, and they understood this in Chinese and Ayurvedic medicine, that the organs are all connected with emotions, and that a lot of times you can take someone that is chronically angry and treat their liver, and they will become calmer and they'll become more sensitive. And we see this all the time in Chinese medicine. The kidneys are connected to sadness. The lungs are connected to loss or grief, and the pancreas or spleen is connected to overthinking and people who just can't get out of their minds, and the heart is connected to feelings and to connections, and so all of the organ systems are intimately connected, probably through neurotransmitters. I mean, we've seen some of the people that get heart transplants have thoughts that are conveyed from the person whose heart it came from, and that's an interesting illustration of how an organ can be connected directly to certain emotions. So we can go back and forth. We can have, but it would be nice to have a single doctor that would be a gut, brain, emotion doctor.
I agree, and I mean 100% that would be amazing, because there was a Dr. Emran, well, there is a Dr. Emran Meyer, and he came out with a popular book called The Gut-Brain Connection. But at this point in my life, I feel like it's the best book for a layperson that really describes how our emotions play out in the theater of our gut, and our gut actually mirrors our emotional state, much like our face has facial contractions. Our gut has contractions that mirror our emotional state. And so this is a system that's going back and forth. The gut is impacting the brain, but the brain is also impacting the gut, which is why it's really critical to always pay attention to the component of stress.
Yeah, I got mad at my dog the other day, and he came in and made a deposit in the hall.
Exactly. There you go.
So they
know it instinctively, right?
Yeah, their colons are directly involved.
Well, and how many of us know that right before a final exam, a final exam, how many students are, in the bathroom because they're having, both directions or one or the other, because that stress response and the way our emotions are does drive the gut in substantial ways. And I agree with you, the more that we nurture the gut and find ways to heal it, the better our mental state is going to be as well. So mental health.
I remember taking the state board exam in Chinese medicine. They wouldn't let anyone go to the bathroom for
they lock the
4
doors
hours during the test. And,
oh my gosh.
That was, so we all learned from the other students that had taken the test that you better take care of that.
Yes.
So, thank you so much for being on. Tell us your website once more, and maybe through that you can write to you or call you.
Yes. Yep, I have a newsletter that you can subscribe to. It's www.lightYourSparkle.life.
And that's not just for July 4th sparkle.
No, Light Your Sparkle has a lot of meaning. It's lighting the inner sparkle, it's energy, it's what feels good when we think of sparkle. So there was a lot of meaning behind the choice of Light Your Sparkle. Becoming who you are when you light your own sparkle allows you to heal. And
your website's done by our mutual friends, Alex and Robin, who are Webelution9.com. They're beautiful artists for really great website. So thank you so much for joining us. I wish we
Thank you for having me.
Callers, but you did great, and we'll have you back. So thank you.
I appreciate it, Dr. Beilin. Thank you so much for having me.
Okay. Well, we'll see you soon.
Okay. Good night.
Bye. So that was Casey Hirsch, HERSCH. And she's in the Sacramento area. And so she has a lot of little tools that she's learned to deal with all the hell that she's been through. And it sounds like they had no handle on the gut bacteria. They had no handle on diet. They had once you start antibiotics, you grow resistant strains in the gut. You acidify the body. You should always be in an alkaline diet with any antibiotic because it's inflammatory. It's pro-inflammatory as it's killing off. And so it's an interesting thing because antibiotics kill off everything. And you hope that what happens is it kills off the pathogen or the disease-causing bacteria, and then the other bacteria that have been partially killed off come back in a better balance. But that hope is a hope, and it not necessarily is the case. The pathogenic bacteria could just mutate and come back as a similar strain, and then you'll need to go to a different antibiotic, and soon you get into things like Cipro and some of the horrible antibiotics that have been lawsuits from the damage that they do. I used to be involved in a small project at USC Medical School in doing analyses of kidneys with different antibiotics, and these kidneys in rats were just completely destroyed by moderate doses of certain strong antibiotics. This is Dr. Dan Beilin. My website's Fortify Health, FORTIFY.com, FORTIFY health.com, the number for our clinic, and we are seeing patients